I'm Dr. Janice Tsang, specialist in medical oncology. So I'm from Hong Kong, and I'm actually serving at the University of Hong Kong and also as president of the Hong Kong Cancer Therapy Society. So basically, I come from Hong Kong, the special administrative region, as part of China, and Macau is the other special administrative region in China. So at the moment, because as you know, China is a super big country, so there are actually lots of advancement in diagnostics and also therapeutics in breast cancer and also other cancers as well. Breast cancer is still the most common female cancer in Hong Kong and also in China, I think echoing the rest of the world. So at the moment, there are actually better awareness about different diagnostics and therapeutics and also advancement of different drug articles and also more fundings in terms of supports for patients and the carers. So at the moment, I think there are better actually access to various kinds of treatment. Though the drug cost still varies, it depends on whether it's public or private, yet there are actually much better exposure in terms of knowledge and also updates of cancer treatment to patients as well as care workers. Well, at the moment, as we know, liquid biopsy actually is near to prime time. So basically, talking about Hong Kong, at the moment, we do have access to liquid biopsy, however, only actually available to those who could afford it, because at the moment, most of the tests in terms of liquid biopsy is still afforded by patients or what we call self-finance item. So this is not funded by the government at the moment, and it's not always funded by the medical insurance company. There are some specific panels, say the breast panel, actually limited to the underprivileged, or those actually are actually meeting the means test as deemed by the social workers with some finite time of like programs. That means these programs are not always available. So there are some funded programs supported by pharmaceuticals and also by some philanthropists, but these are limited numbers. So I would say it's not equally accessible, not available to everyone. At the moment, only those who could afford or those who could actually be eligible for these actually privileged or compassionate programs. And at the moment, this is more available to those with advanced disease in breast cancer, especially talking about further resistance in hormone-positive patients, ESR1 mutation, or PIK3CA, or other driver mutations. So these are sort of like the current situations. And with ctDNA monitoring for early-stage disease, as we know, it is upcoming, yet this is not the prime time, not actually in reality in the clinics at the moment. So hopefully with more data and more coalition for better equity as hopefully available to all patients, this could become available to patients when the solid data is out further.